Hello, this is Dr. Salim, Dr. Physical Therapy from Brooklyn, New York. Today I want to show a live case who needs a visceral mobilization. Let's look at the contraindications for visceral mobilization. There is no so many contraindications for visceral mobilization, but one major contraindication is aortic aneurysm. Aortic aneurysm, it's present, like prevalence is 7% of the population have aortic aneurysm. It's more in elder men than women. Over 60-year-old men may have aortic aneurysm. Let's look a little bit about the anatomy here. Okay, if you go, here's a belly button. What are the symptoms of aortic aneurysm? The symptom for aortic aneurysm, either left side abdominal pain or give you back pain. Okay, so the aorta is going here exactly, and at the level of the umbilicus, the aorta bifurcate. Give the iliac arteries here. Could be also some iliac aneurysm, but it's not common. My most common aortic aneurysm is if you go from the umbilicus, you go 3 or 4 fingers up. Okay, here, the aorta will give bifurcation for the renal arteries. You just go for the left renal artery, right renal artery. It could be the aneurysm at this level as well, at the renal artery, but the most common aortic aneurysm, it happens at this level, between the umbilicus in the left side and between the bifurcation for the renal artery. It comes like this. How I can palpate the aorta? See, you cannot do sagittal palpation. You have to be transversely. You have to go deep like this. This to palpate the aorta. You're going to go deep and you're going to go like this. Here the aorta is under my hand now. When the aorta is under your hand, transverse, you go deep here. You check it's tender or no. Then you try to feel the aortic pulsation. You can feel the pulse now. Okay. Also, you can measure the aorta between your hands, guys. You can put here the side of the border. Then go the other aorta. Now between the two fingers now, this is the aorta. The normal diameter of the aorta is 35 millimeter, 3 centimeters and a half. If it's more than that, if it's actually like 45 millimeters and up, this give you big, susceptibility of aortic aneurysm. If you have you measure it, is this more than 45 millimeter, 4 centimeter and a half, is 1 centimeter more. This is you have to suspect aortic aneurysm, and what you do, you need to send the patient for primary doctor, specialist for abdominal sonography to check the aorta and check rule out aortic aneurysm. Okay, so the main criteria for visceral mobilization is the aortic aneurysm, and we spoke about the anatomy of the aortic aneurysm, how to palpate the aorta, how to measure it roughly with the fingers. Okay, you can do in supine, and I can do on a patient lying on the other side as well. Patient on the left side, I can measure the aorta and I can move. Can I check is hurting? Does it hurt to you? Yeah, 50-50. I'm gonna send my patient today, although he has normal size, but it's tender there, and has tenderness also here. And I did the counter strain. This is what I suspect when the patient has tenderness here. I could suspect the psoas muscle. I did psoas counter strain, so we cannot relax. It didn't help it much. It could be the small intestine spasm. We did the advanced counter strain for small intestine. It didn't help much. That's why I'm going to send my patients for his primary doctor to give him abdominal sonography and rule out aortic aneurysm. Could be aneurysm here, could be aneurysm bifurcation. Most likely it's not there, but it's better to be safe than to be sorry. So always refer, if there is a red flag, refer your patient. By now, share this video because so many people need this information, and subscribe if you see the first time, and press like and stay tuned for more videos. Bye now.